So now that you've seen an indwelling catheter in a female, I'm going to show you the difference in a male client. So setting up your sterile field and putting on sterile gloves will be the same way. You're still going to use your patient's bedside as your sterile field. But there are a few differences as far as insertion for male clients and the female client. Okay? For example, same item or same procedure as we would for the female, I'm going to go ahead and get all of my stuff ready so I can clean my client and be prepared to insert the catheter. Okay, so just like before, I'm going to get my cleaning agents open and ready. I'm going to take my lubrication and open it. That way I have something nice for my catheter to sit in while I'm waiting. Okay. And then I'm going to take the catheter and sit it. So remember from the last video where I showed you how to insert the balloon or what the balloon would look like inflated. And keep in mind we're not supposed to be testing out our balloons before we insert them, just showing you what it might look like inside the bladder once inflated. Okay. So I'm going to take the tip of the catheter and put it into its little bath of sterile lubrication and just let it hang out while we're waiting. And then I'm going to prepare our sterile water or sterile saline and go ahead and connect it to the port so we can insert the fluid for the balloon when we're ready to insert the catheter. Okay, so everything is ready to go. So here's where you'll see your main change. So for the cleaning of the male client, you're still going to use all 3 swabs, but instead of going up and down, you're actually going to take your dirty hand and pull the shaft up, and you're going to do it in a circular motion. Okay, so from in to out. So I'm going in and around. Okay, sorry, buddy. And you're going to do that 3 times. In and around. So again, difference from female to male. Female is straight up and down, and male is going to be circular. Okay. Also, the other difference for inserting a catheter into a male client is when we're ready to insert the actual catheter, instead of going until you see urine, we're actually going to insert the catheter all the way to the Y port. Okay, so you'll see the Y bifurcation in the actual tubing, and you're going to insert all the way. The reasoning is they have a longer urethra than females, so we want to make sure that when we put the water or the saline into the balloon, that we don't expand the balloon inside the urethra itself, and that is all the way into the bladder. Okay? Make sure you stabilize the catheter, and you'll go ahead and explode your balloon. Explode it. You'll insert your water. And then you're ready to go. Then just like before, you're going to want to hang this below the urethra, okay, using the gravity so the bag can collect with the urine. And you're going to get your stabilization device. Okay? For the males, it might be a little bit harder because you have your Y bifurcation up here. But there are bands that some facilities will have to where you can put them around the thigh so it will stabilize it and be a little more comfortable. Okay? And that is how we insert a Foley for a male. So to take it out, same thing. You're going to get your empty 10 ml and let that water or saline come right back out. And then you'll gently pull out your catheter. So to take out the catheter, it does not have to be a sterile procedure. A sterile procedure when putting in anything invasive is very important. And that's it.